Southern Plains Medical Center presents your hometown medical minute, and your host, Hal Brock.
Hey everybody, happy Friday and welcome to our show, Your Hometown Medical Minute. I'm your host, Hal Brock. With me, as always, behind the cameras, our IT director, Mr. Ed Harrison. Ed, how you doing today, buddy?
Pretty good, Hal. Did you have a good week?
Man, absolutely. I'm excited for the weekend. I'm excited for a little bit cooler weather. But brother, we have got a great show for everybody today. Of course, here at Southern Plains Medical Center in Chickasha, we have more than 17 medical specialties that we practice right here in an outpatient clinic, 2222 West Iowa in Chickasha. Well, today we're gonna meet a new specialty and a new doctor that's gonna be coming down to Chickasha. And this is a specialty, a service that has not been provided in this market as of yet, and we're talking about interventional radiology. Today, we're gonna meet our newest strategic partner, NAADI Health, and Dr. Ramana. Dr. Ramana is gonna talk about some of the practices he does in interventional radiology. Ed, I had the opportunity to drive up to his surgery center up in Oklahoma City and actually film some of these procedures, bro. These are amazing people, amazing individuals. What they're able to find through the vascular system can alleviate pain. So this can be an alternative treatment for pain management, an alternative to opioids, of course. So just another one that Southern Plains has brought down to the market. As well, you know, they do chronic venous occlusions. They do peripheral arterial disease and diagnose that. So just amazing technology. We're gonna show you some of the clips. I'm not sure on the Facebook rules on what all we can show on surgical procedures. I'll look that up. And then depending, you might see some here. If you don't, go over and search on YouTube, Southern Plains Medical Center, and then I'll have those uploaded maybe sometime early next week. Dr. Ramana starts down here in Chickasha next Thursday, September 5th. Super excited to have him here. You guys are going to love this episode. So let's bring out Dr. Ramana, talk to him. Talk to his radiology technician, Shelby, as well. She also does some of the procedures, and then we'll go from there. All right, I want to welcome our guest, Dr. Ramana and Shelby Dudley. They are from NAADI Health, and NAADI Health is actually going to be down here at Southern Plains starting here in September. They do some wonderful things, and definitely thank you guys so much for coming down, Dr. Ramana.
Thank you for the opportunity to be down here.
Absolutely. And so you're an interventional radiologist.
That's correct.
Could you explain to our audience just kind of a few things what you do?
Sure. So an interventional radiologist uses diagnostic imaging. So for instance, CT, MRI, ultrasound, fluoroscopy. They use those to help guide procedures that treat many different conditions that patients might have. My special interest is in vascular diseases. So I treat people who have peripheral arterial disease. We do angiography, angioplasty, atherectomy, stent placements in the legs, primarily arterial disease in the legs. We also treat problems in the venous system in the legs.
Okay.
And people who have non-healing wounds in their legs, ulcers, scoreal, or bad infections that don't respond to treatment. A lot of times it's related to blockages in their veins as well as in their arteries. For sure. And we also treat people who have significant chronic back problems with chronic pain. We can do injections for their back. We can also do pain pump implantations. Okay. Stimulators, neurostimulators, kind of like a TENS unit. For sure, right? They put the stick back there? Okay. Exactly.
It's very prevalent in our area, of course. Two of our largest comorbidities here, diabetes, and then as well, we have a lot of DVT here. So, and that comes a lot with diabetes, correct?
That's right.
Okay,
yes,
cool.
They may have scarring from their DVTs, which didn't resolve fully or were not treated aggressively. Or they may have underlying clotting abnormalities which make them susceptible to recurrent DVTs, and that will lead to chronic blockages in the venous system and lead to swelling and ulcers and infections.
Goodness gracious, yeah,
and ultimately to amputations, and that's the thing that we really want to prevent. That's a major interest of mine.
Absolutely. I mean, and it should. I mean, thank you so much for all that you do. I mean, that's saving lives. Absolutely. Now, what's kind of the process of going in there and helping them with their problems, especially in the diabetes, the DVT?
So we will do screening exams. We do ultrasound exams to check arterial and venous blood flow, and then if we find, based on the ultrasound and all the physical exam and the history, that there's reason to do something more aggressive, then we'll do venography.
Okay.
And we put an IV into the vein, inject X-ray dye, and check for blockages in the venous system. And if we find it, we can treat the blockage by putting a stent in the vein. And a lot of times we'll see improvement right there while they're at the center.
That's
in
amazing.
The recovery area. See their swelling that they've had for years go away almost.
Right there. Right after you've done the
after
procedure.
Yeah,
that's amazing.
Yeah.
You know, and I was fortunate enough to get to come up to your center this past Monday and check some out. Now, what did I get to witness on Monday? Because this was amazing. I literally saw these people put in a 5-foot wire and like people like 5'4". I mean, it was absolutely amazing, but such precision and such skill. Your entire team was like the nicest people I've ever met. All your patients were totally comfortable, at ease. It was amazing. Now, what were you doing there?
So we were treating arterial diseases in the legs in those cases. So we were putting an IV into the artery through the groin and advancing catheters and wires into the artery in lower leg. We need long wires because of the devices that we use to treat them. We do balloon angioplasty, and we were actually doing an atherectomy, which is using a device to shave off plaque from inside the artery. And then once we shave off the plaque, then we use a balloon to open the artery to its normal size.
That's incredible.
So the devices have to be long so that we can get to the area that needs to be treated from one side of the leg to the opposite end of the other leg. So that's why we're dealing with this long wires and catheters.
Well, super amazing to see. Now, you mentioned something earlier that also hits our market. 8 out of 10 Oklahomans, and basically everybody in America, will have some kind of neck and or back problem sometime at their life, right? And so here in rural Oklahoma, with all the manufacturing we have here in Chickasha, ranching and farming, it's very prevalent. About 85 to 90% of our patients have neck and or back pain. So what you're talking about is totally opioid free and kind of a pain management device,
exactly.
Right?
Yes, that's right.
That's amazing. That's awesome. Now, about how many do you do? How long have you been doing the stimulators?
I've been doing those for about 3 years.
About 3 years.
Yeah.
Very neat.
Yeah.
Okay, and Shelby, you're a radiology tech.
That's right.
Is that correct? Okay, and how long have you been with Dr. Ramana?
A little over 2 years.
Okay, perfect. Now you work with the C-arm, right?
Yep.
A little bit?
That, and I also scrub into the procedures and work with the wires and catheters. And
I saw you doing
as
some
well.
of that. Amazing. Can you describe what the C-arm, how it works, and because you guys were moving that thing up and down, and some of the images that were coming up, that was one of the most exciting things I've ever witnessed. I mean, when the image of the veins came up, I mean, it looked like we could stick that on a wall.
Yeah, it's kind of a big piece of equipment, but it's called fluoroscopy. It gives you a live image, and we use something called contrast, and through that IV that we start, we inject the contrast into the vein or artery, and by using the C-arm and using fluoroscopy, you can see that move through the vein in live time.
Wow.
And that's what lets us be able to see the wires or the catheters as we manipulate into that vessel and get to where we need to go. And we're able to do something called a roadmap, which leaves that mask on the screen and basically gives you a map of where you need to go. That's how you select these little vessels and work your way down the leg wherever we might be working.
That's super amazing, you guys. So, okay, that's super cool. So we've got some cool things. They're going to be starting here in Chickasha, starting in September. So you guys are definitely want to check this out. I mean, diabetes, if you've got cardiovascular issues, vascular issues, this is something that's very important, life-saving stuff. I want to talk real quick about screenings, how that kind of the process, because we just kind of went over it. It's a super easy process. So nothing anybody should be afraid of, but also in September, you guys just happen to be starting in a very cool month. It's PAD Awareness Month. So if you guys could kind of talk to us a little bit about some of the screenings that you do for PAD, and then what we can do, your event that's coming up in September.
Peripheral arterial disease, or PAD, is a very important diagnosis to make in patients, and our goal is to prevent the horrible complications of the chronic infections and ultimately the amputations that people undergo as a complication of the PAD. And people who are diabetics, smokers, have high blood pressure, and some people with family history and sedentary lifestyles are all at risk for it.
Okay.
So it's a very important thing to screen for. And we've been using a device for about 5 years that does a quick 5-minute screen. Really? It gives a very reliable indication. Is a very reliable indicator of peripheral arterial disease, okay. And it looks like a little pulse ox device that you put on your fingertip.
Okay.
And the test is about 5 minutes, and it gives you a good indication of whether there's arterial disease or not.
Wow, that's amazing. I mean, literally, it's just something you stick on your finger, and 5 minutes later.
That's right.
I mean, that's amazing.
And that's something that we would like to introduce here to the Southern Plains community, to be able to screen a large number of people quickly and identify the people who are at risk for it, and base further evaluation on that.
Well, it definitely sounds like things that you can go in, clean up for people, as long as we're aware. I mean, so many of these things, the progression is so quick. So if you don't catch it, if you're not getting screened, man, all of a sudden you could be without a limb. I mean, I'm not trying to make light of it. That's a real thing, right?
That's right. And the other side of this is that the problems that you're getting in the arteries of the legs, the same kinds of arteries are everywhere in your body. So you could be developing the same blockages, the arteries to your heart, to your brain, to your kidneys. So it affects the entire body. And so people who have significant arterial disease in their legs probably have significant coronary artery disease, so they may be at risk for developing an MI or a stroke. Yeah. So it's important to pick up on this, not just for the legs, but for the whole body.
In a 5-minute test, and we are going to start doing this screening with our primary care doctors. So I mean, it's an option. It will be here September, October, once we kind of get the program running down here. So really cool thing happening up at your place, right? In September, October, you're going to be having an event up there?
We'll be hosting a PAD awareness event. We don't have the exact date yet. We're going to let you know, and that way you can let everyone know, and they can come be a part of it. We're going to have this screening device there with us, and we will be doing free screening devices on everyone that would like one. And we'll have lots of other fun stuff. We'll have some catheters and balloons, some of those wires that he talked about that everybody can look at and touch and see what they're like. And we'll probably have some food and just lots of fun stuff to come. And we're doing this to educate the public on PAD. It is an important thing for the public to know about and know what signs to look for and how to catch it.
Well, prevention is the best thing that we can do in medicine for people, and so thank you guys so much for that opportunity for the population. So we'll have more videos, we'll have more information here on our Facebook page as well. Check us out on Facebook Watch or our YouTube channel. Give us a call, 405-224-8111, and also go to our website, www.spmcmed.com. Thank you guys so much. Talk to you later.